Hi, everybody. I'm Dr. Bryan Ardis, and welcome to the Dr. Ardis Show. This is an incredible, very exciting presentation, and it applies to everybody around the world, especially all those in America. All right, so this is a special PowerPoint presentation I'm going to be doing. It's actually titled How the HPV Vaccines Cause Infertility and Cervical Cancer. All right, so when I said this applies to everybody, just so you know, every male and female in the United States of America, starting at age 9 years old, is recommended to get an HPV vaccine. HPV stands for human papillomavirus. This PowerPoint, remember, every American in America at age 9 years old, boy or girl, you're told you need an HPV vaccine to prevent in the future cervical cancer in females, penis cancer in males. So they start injecting males at age 9 and then recommend primarily for girls at age 11, every 9-year-old and 11-year-old. So if you're a grandparent or an uncle or an aunt, you don't think this applies to you because you think you're older than those ages. You've got nephews and nieces. You've got grandkids. You've got children. They should all know this information. So I have a PowerPoint here about everything you need to know about HPV vaccines. The primary one right now being given to all 9 and 11-year-old children in America and around the world is called Gardasil. It's actually called Gardasil 9, but we'll get into everything you need to know about this HPV vaccine because it absolutely is known to cause infertility, and it is published in medical studies. They know that the HPV vaccine causes a very specific percentage of all people who receive that vaccine to become infertile, and they know exactly how it does it, and I'm going to show you. They also know, and so do law firms, they know that HPV vaccines, which are promoted to prevent you from getting cervical cancer in the future, absolutely are known to cause cervical cancer to form. So there are law firms all over America who are profiting off of you developing cervical cancer or infertility as a result of getting the HPV vaccine, which is promoted to you, young parents and grandparents, for your children and grandchildren to make sure they get that shot to prevent. So you might want to ask yourself, how come law firms are making tons of money suing the companies that make Gardasil, the HPV vaccine thrown around at all Americans? How do they know they can profit from going to court and suing the makers, Merck, of Gardasil? Well, you're about to find out why. All right. So please, when I say this applies to everybody, every man and woman in America at 9 and 11 years old has been given the HPV vaccine called Gardasil. So if you would like to make sure that your family continues to progenerate, continue to have generations after you and a posterity of any kind, you might want to know about the HPV vaccine. So here we go. And all of you out there who think the HPV vaccine is the only way to prevent cervical cancer, you're a moron. You haven't studied. You haven't watched the Dr. Ardis Show, and your medical doctor is ignorant. And ignorant means they are very uneducated. So if you are a medical professional and you believe that the only way to prevent cervical cancer and the best way to do that is through the HPV vaccine agenda and program, you are sorely mistaken. So pay attention, because when we wrap up this presentation, you're going to see 4 very specific nutrients that all by themselves in research studies, peer-reviewed, published in medical journals around the world. When I say you're ignorant, you didn't know this stuff and you haven't read it. That's okay. My job is to make you less ignorant. I love becoming less ignorant every day as I research and study what medical science and the federal health agencies of the world have already proven. The proof is nature wins. It actually outperforms HPV vaccines' effectiveness. So here we go. Let's dive in. I've got a PowerPoint I'm going to be showing all of you. Follow along. Remember, you can go to the resources tab of the Dr. Ardis Show. Go to the resources tab, click it. You can download this entire PowerPoint, the PDF of this PowerPoint for free. Just download it and send it. Just download it to your computer or your phone, then send it to all your loved ones, especially the young parents of those with 9 to 11-year-old children who are all being told they need the HPV vaccine to continue in middle school and high school. around the country. All right, here we go. And then everyone else around the world, if you don't live in a country where you're being told you need the HPV vaccine to go to school and to prevent cervical cancer and penis cancer in the future, if you aren't a part of that type of agenda and don't have a government forcing that down your throats like we do here in the United States, all vaccines, you need to watch this. If you know of people in your country who also have been diagnosed with cervical cancer or penis cancer, this is for you. Because I'm going to show you what's been proven to reverse cervical cancer and prevent it, which they say is caused by this virus. Just so you know, you don't need a vaccine to cure this. I'm about to show you 4 nutrients proven to do it all by themselves. And if you combine them all together, what a more incredible, miraculous opportunity you have to heal and prevent ever developing that cancer. All right. So what your medical doctors don't know and what they won't tell you and what your oncologists don't know either. And specifically what your pediatricians don't know unless they're watching the Dr. Ardis show. Let's show you what science and medicine knows about the HPV vaccine. Here we go. So follow along. All right. It's titled HPV Shots Cause Cervical Cancer and Infertility. All right. So here we go. I'm just going to blow this up for my own convenience so I can read all these screens. All right, so here we go. HPV vaccine linked to higher rates of cervical cancer screenings. All right, this doesn't mean you have more incidence of cervical cancer. However, those who receive HPV vaccines, they find they are getting and having to be recommended more cervical cancer screening tests than anybody else. Why would they need more screening tests for cervical cancer when the HPV vaccine is the only thing the medical profession and the CDC tells you is the way to prevent HPV-caused cervical cancer? And yes, they say 100% of all cervical cancers are caused by this HPV virus. So let's find out what they're saying. HPV vaccines debuted in the United States in 2006. In order to be fully vaccinated, patients may require 2 or 3 doses of the HPV vaccine. I'm only going to read the highlighted sentences here from these articles, and every article has its reference at the bottom of the screen if you want to go look it up yourself. HPV vaccinated individuals were more likely than unvaccinated patients to undergo cervical cancer screenings. Why? Why would HPV vaccinated people need more cervical cancer screenings? I would think it would be the opposite. According to these findings, those who received 2 or more doses of an HPV vaccine were more likely to have cervical cancer screenings. Why? You already got the vaccine to prevent getting cervical cancer, supposedly. Why are you getting checked for cervical cancer more often than the unvaccinated? Seems weird. All right, here's the CDC's article on HPV, human papillomavirus. This is about the HPV vaccine. Let's see what they have to say. The HPV vaccination provides safe, effective, and lasting protection against the HPV infections that HPV vaccination provides safe, effective, and lasting protection against the HPV infections that most commonly cause cancer. The HPV vaccine series is most effective when given before a person is exposed to the virus. Every year in the United States, HPV causes about 36,000 cases of cancer in both men and women. Here's the CDC's recommendations. Children ages 11 to 12 years old should get 2 doses of HPV vaccine given 6 to 12 months apart. HPV vaccines can be given starting at age 9. Only 2 doses are needed of the HPV vaccine if the first dose was given before the 15th birthday. First dose, 11 to 12 years old, can start at age 9. Second dose, 6 to 12 months after that first dose. Children who are 9 to 14 years old who have received 2 doses of HPV vaccine less than 6 months apart will need a 3rd dose, less than 5 months apart. People 15 to 26 years old who start the series later need 3 doses of HPV vaccine. The doses are given over a 6-month period. And then people older than 26. So I know all of you out there are like, this doesn't apply to me. It applies to everybody you know. People older than 26 years old, vaccination is not recommended for everyone older than age 26. That's interesting. It's that effective. Why aren't they giving it to everybody at every age? All right. Why getting vaccinated is important, says the CDC. HPV is a very common virus that can cause cancers later in life. About 13 million people, including teens, become infected with HPV each year. You can protect your child from these cancers with HPV vaccine. Yeah, right. All right, here's the available vaccines. Gardasil 9. Just so you know, at the top, you'll see there are several types of HPV vaccines, and that's why HPV vaccine is recommended earlier than later. All right, here's the one. Gardasil 9. Gardasil 9 is the vaccine distributed in the United States. This vaccine protects against 9 HPV virus types: 6, 11, 16, 18, 31, 33, 45, 52, and 58. All of the HPV vaccines, they state at the bottom, protect against HPV types 16 and 18 that cause the most HPV cancers. All right, here is another CDC document titled Human Papillomavirus. I have to show you guys something out of this one. This is very, very important. All of you are being told that every child 9 to 11 years old in America has to be receiving 2 or 3 doses of the HPV vaccine. Listen closely, read closely. This is the CDC's pink book on HPV virus and its vaccines. Those who have the human papillomavirus, their clinical features are this. If you ever contracted HPV, most, not some, not a few, per the CDC, most human papillomavirus infections are asymptomatic, meaning you get no symptoms, and result in no clinical diseases, which includes cancer. Let's read that again. The CDC says, people who get the human papillomavirus, most of them will be asymptomatic and will have no clinical diseases as a result of carrying the HPV virus. Was it a few? Was it a couple? No, most of you, even if you get it, will never have an illness, will never have cancer, and will never have a symptom. Oh, look down below on the screen. Most HPV infections are asymptomatic and result in no clinical diseases. Do your pediatricians know that? And do they tell you that when they say you have to get the HPV vaccine to prevent HPV virus infections that will lead to cancer in the future? Do they tell you most of people who carry HPV viruses will never have cancer, will never have any diseases related to that virus, and will never have a symptom? Then what's the urgency and why the mandates to have every child vaccinated, male and female, for this vaccine if the virus you're trying to prevent doesn't cause most people to have any symptoms or diseases or cancers? Oh, that's okay. Let's just vaccinate everybody anyway. All right, this is the CDC's vaccine schedule, and I want you to see, we're going to highlight what I want you to see. On the vaccines and immunization schedule, you will see the HPV vaccine they publish is most recommended, you will see, for those between 7 to 10 years or 11 to 12. It's really 9 to 12. Now, I want to highlight on this chart on the CDC's website where it says, see notes. You see that in the red box? See notes. So I clicked that button, and this is what it shows you. HPV vaccination routinely recommended at age 11 to 12 years, can start at age 9, and catch up on HPV vaccination recommended for all persons through age 18 years, if not adequately vaccinated. My focus is on this statement. HPV vaccination is recommended for all persons through age 18 years old. That's what they wanted you to see on the notes. Every American needs this. All right. Human papillomavirus vaccination coverage in children ages 9 to 17. This is per the CDC itself. In 2022, 38% of children ages 9 to 17 had received 1 or more HPV vaccine doses. I find that very exciting. That means only about a 1 in 3 children have adequately been vaccinated for HPV. Thank God. The percentage of children who have received 1 or more HPV vaccine doses increased with age. From those being 9 to 10 years old, it was only 7% of those kids. Then from 11 to 12 years old, it was 30.9% of those kids were vaccinated. For those 13 to 14 years, it was 48.8% of parents got their kids vaccinated. And then those 15 to 17 years, it was 56.9% of those kids. Hispanic children were less likely than white children to have received one or more HPV vaccine doses. Now, how do they treat HPV pharmaceutically? There is only one. It is the HPV vaccine. All right, so this is the CDC's about HPV vaccines. All HPV vaccines have been found to have high efficacy, close to 100%, for prevention of the HPV vaccine type-related persistent infection. Cervical intraepithelial neoplasia, CIN, cervical cancer, and adenocarcinoma in lab studies and in clinical trials. This is from the package insert of the HPV vaccine. There's only one right now. I actually think there's two, but they tell you there's only one. You're going to figure out. They're both Gardasil, by the way. So looking here, this is the highlights of the prescribed information for Gardasil. These highlights do not include all the information needed to use Gardasil 9 safely and effectively. This is for the human papillomavirus. You will see there. This is directly from the package insert. Hypersensitivity, including severe allergic reactions to yeast, which is found in the vaccine, or after a previous dose of Gardasil 9 or Gardasil. Because vaccines may develop syncope, warnings and precautions, syncope, changes in your heart rhythm. Because vaccines may develop syncope, where you may faint, sometimes resulting in falling with injury, syncope, fainting, sometimes associated with tonic-clonic movements and other seizure-like activity, have been reported following HPV vaccines. Did you know that seizures and going into a coma were known warnings of the HPV vaccine? When syncope, fainting from the HPV vaccine, is associated with tonic-clonic movement, seizure movements, the activity is usually transient and typically responds to restoring cerebral perfusion by maintaining a supine or a Trendelenburg position. Did you know these warnings for all of you getting the HPV vaccine? Any of you have children that have seizures since getting the HPV vaccine that they didn't have before? Adverse reactions, the most common. More than 10% of all people have experienced these reactions when getting the HPV vaccine. In girls and women 16 to 26 years of age, injection site pain in 90% of people. That makes sense. You just punched a hole in the skin with a needle. Injection site swelling. 40% of people have swelling. Injection site erythema, redness, rash, 34%. Headaches in 15% of all of you. In girls 9 through 15, injection site pain in 90% of you. 50% of you have swelling, erythema, red rash in skin, 35%, and headaches in 12%. In women, 27 to 45 years of age, injection site pain in 83%, swelling, 23%, red skin, 16%, and headaches, 13.6%. In boys, 63% had pain where they stuck the needle, 20% had swelling, and redness of the skin, 20.7% with rash. Boys 9 to 15 had swelling, pain, 71%, swelling, 30%, and injection site skin changes, 25%. Those don't seem very severe. So let's go to drugs.com. Look at Gardasil 9 vaccine, known as, you see the generic name there, HPV vaccine. These are some of the more common side effects listed on drugs.com. Local, very common, 10% or more. 91% will have injection site pain. 50% will have swelling. 50% of you will have redness of the skin. Very common, 54% will experience fatigue. 53% will experience headaches, pyrexia, 13% fever of 99 plus 13% of all of you. Look at this. Up to 10% of all people will develop chlamydia. The infection, you will develop an infection of chlamydia in 1 out of 10 people that get the HPV virus vaccine. Hold up. Why would you get a sexually transmitted disease from a vaccine? There's no chlamydia in the ingredient deck. I've reviewed them. So how are up to 10% of all people that get the HPV vaccine developing chlamydia? It must be in the shots. at least in 10% of the shots. Now, look, up to 1% of people it's reported have died. That means for every 100 people that get the HPV vaccine, for every 100 kids 9 to 12 years old, they die. You want to take that risk with your kids or grandkids? I don't. What if I was throwing out Halloween candy and for every 100 kids that came to my door, I told you, for every 100 kids that come here and I give them a lollipop, 1 out of 100 will die. Would you come to my house? Would you bring your kids to my house? Would you play Russian roulette with them, even though it's only 1 in 100? Would you still come by my house, knowing if I put a sign above my door, 1 in 100 trick-or-treaters are going to be given a lollipop with arsenic and cyanide and they will die? Would you? If you would, you shouldn't be a parent or a grandparent, in my opinion. All right, gastrointestinal diseases up to 10% will develop toothaches, tooth pains, abdominal pain, vomiting, diarrhea, nausea from the HPV vaccine. Musculoskeletal, up to 50% of you will develop lingering muscle pain and arthralgia. Joint pain, extremity pain. Respiratory, up to 10% will develop influenza. Look at that. Did you know you can get the flu from the HPV vaccine? You can get the flu, 1 in 10 people. Upper respiratory tract infection, pneumonia, bronchitis. Did you know it was a side effect of HPV in 1 in 10? Let's keep going. 10% will develop dizziness or migraines. After the human trials, the same people that received the HPV vaccines later reported continuous seizures, Guillain-Barré syndrome, being paralyzed, neuron diseases, motor neuron diseases, Parkinson's, shaking, paralysis right in front of seizures. How many of you like the odds of your children not experiencing any of these issues with the HPV vaccine? Look at this, genitourinary symptoms, drugs.com, HPV vaccine, up to 10% will develop dysmenorrhea, changes in your menstrual cycle, vaginal infections, urinary tract infections. Ask your doctor if vaginal infections are right for you, and chlamydia. Oh, cardiovascular-wise, after the HPV vaccine trials were over, people reported deep vein thrombosis, big blood clots in their legs, causing them to have amputations, possibly stroke, heart attack. As far as the immune system goes, when it comes to the HPV vaccine that's supposedly helping to boost your immune system against the HPV virus in the future so you don't get cancers, look at this, up to 10% of all people in the clinical trials for HPV vaccines developed new medical conditions potentially indicated as systemic autoimmune disorders, of which you will see below a list of all the ones that were reported in the HPV virus vaccine trials. Did you know the HPV vaccine has been shown to be causing, the HPV vaccine itself could cause arthritises, autoimmune thyroid conditions, celiac disease, diabetes mellitus, insulin dependent. How about hyperthyroidism, hypothyroidism, inflammatory bowel diseases? Did you know HPV virus vaccines in trials was shown to cause multiple sclerosis in up to 10% of all people? MS. What about Raynaud's phenomenon, where your fingers and toes go white, no blood circulation when you get cold? What about pigmentation disorders? Did you know that vitiligo, where your skin loses all of its pigment, is a known side effect in up to 10% of all people who have gotten the HPV vaccine? Optic neuritis, pain in the back of your eyes, nephritis, inflammation of your kidneys, rheumatoid arthritis, scleroderma. Oh my God, that is horrific. Steven Johnson syndrome, go look that up. Systemic lupus. Alopecia, losing your hair, is a side effect of HPV vaccines. Ankylosing spondylitis. Anybody don't like their spine fusing together? Autoimmune thrombocytopenia, developing blood clots anywhere in your body and brain. Myocarditis is a published side effect of the HPV vaccine. How many of you avoided the COVID-19 vaccines because of the myocarditis being caused in so many teenagers and adults? Did you know HPV vaccines cause this? Skin depigmentation, I've already talked about that. It's vitiligo. Vasculitis, I didn't know anybody likes spider veins. Vitiligo, you see it there. All right, so now let's dive into some law firms. These are lawyers' offices. For all of you out there going, there's no problem with the HPV. Oh, yeah, there is, and lawyers know it. So here is King Law. They tell you here on their website, we are not currently accepting new Gardasil cases at this time. Would you like to know what kept them so busy and overwhelmed and why they're not taking any more? Look at this. Merck & Company has recently come under scrutiny for allegedly fast-tracking the approval process and overlooking dangerous side effects related to the use of the drug Gardasil 9. Merck & Company is now facing several lawsuits related to the use of the HPV vaccine. Lawsuits allege that the company concealed the known health risks associated with the use of the drug and misrepresented its efficacy against cervical cancer. If lawyers are picking this up, they must have documentation to back it up. On the King Law Firm website, robertkinglawfirm.com, he lists here the documented side effects of Gardasil. Look at the list. Autoimmune disorders such as lupus and arthritis, interconnective tissue disorders, rheumatological disorders, idiopathic, unknown blood clotting disorders, neurological disorders including seizures, epilepsy, and Guillain-Barré syndrome, brain fog or difficulty concentrating, multiple sclerosis and paralysis, cardiovascular issues including POTS and tachycardia, irregular heartbeat or tachycardia related to the HPV vaccine itself, severe arrhythmias and heart attacks, pulmonary embolism, blood clots in your lungs. This is one of my favorites. Cervical cancer is a known side effect of Gardasil, the one vaccine they say every American boy and girl needs to prevent cervical cancer in the future. The only thing the CDC and FDA say causes cervical cancer is the HPV virus. Nope. You can go to this law firm's website right here. They have documents, obviously. There's lawsuits against Merck on behalf of patients who have developed cervical cancer from the HPV vaccine. God bless America. All right, let's keep going because this is really awesome. Check this out. They're giving this to 9 to 12-year-old kids, 2 to 3 doses. Did you know that Gardasil has a side effect of causing reproductive disorders such as premature ovarian failure? This is an ABC News article. Doctors being interviewed by ABC News call the claims that Gardasil caused these 2 sisters' infertility bogus. And this is from 2013. So let's read a little bit into this article. November 8, 2013, 2 Wisconsin women are in federal court today alleging that Gardasil caused them to go into early menopause and become infertile. But doctors say such claims aren't rooted in science. Madeline and Olivia Mailer of Mount Horeb, Wisconsin, claim that the vaccine against cancer-causing human papillomavirus, or HPV, caused primary ovarian failure in both of them. The sisters are 20 and 19 years old. Remember, they're 20 and 19 years old. The doctor ABC News is interviewing is named Dr. Kim Gessie. She says, quote, there is nothing about this particular vaccine that would make this at all plausible. Oh, what an ignorant soul. She continues here. There is nothing hormonal in Gardasil. That is true. Or anything anti-hormonal in Gardasil. That is not true. Nothing that should encourage the body to stop producing ovarian hormones. Oh, I'm sorry. Somebody must be paid by Big Pharma. Their employer doesn't want them to say anything different. So let's just continue learning from this doctor who doesn't know anything, obviously, other than what she's being told to say to ABC News. Like the flu shot, she says, the Gardasil vaccine contains an inactive virus, triggering an immune response in the patient, she says. Well, is she right? Check this out. This is going back to Robert King Law Firm. Lawsuits filed against Gardasil indicate that some of the adverse effects of the vaccine may be related to its ingredients. The drug contains controversial ingredients such as AAHS and polysorbate 80, which have been linked to an increased risk of cognitive impairment and motor issues. Symptoms and health effects of the Gardasil vaccines are summarized on the screen on the lawyer's website, and they include reproductive disorders, which the doctor in the ABC News article says it's not plausible, and then also premature menopause, which would make you infertile, are published known side effects that are now being held in court, being shown against Merck, the maker of Gardasil. This is the CDC's document called the Vaccine Excipient and Media Summary. Appendix B is what it is known as. I just cropped out of this document the human papillomavirus Gardasil 9 vaccine and its ingredients. And I want to highlight a few of these for you. I want you to first focus on the arrow pointing down. That is aluminum. So the first thing in there is aluminum. Aluminum is a known neurotoxin, and I just showed you on the law firm's website, it causes motor dysfunction and diseases and neurological diseases. Yes, it does. That's the aluminum. The second arrow, bottom left, you will see polysorbate 80, a known obesogen, causing you to be fat and not be able to lose that fat. That is what polysorbate 80 is. It's also known to destroy the vertebral column of all mammals and cause you to be disfigured, leading to scoliosis and other issues. And then also yeast. Oh, it also damages the blood-brain barrier, polysorbate 80. To make it easier for all aluminum and toxins in the world that we're exposed to get to the brain and cause neurological damage and diseases. The third thing I wanted to highlight is the yeast protein, because I showed you earlier that there's a complication and a side effect published about the HPV vaccine leading to yeast infections. Yeah, it's got yeast in it. So yeah, that can absolutely cause it. This is from RobertKingLawFirm.com's continued article about Gardasil's lawsuits, the HPV vaccine made by Merck. This is published Gardasil side effects long-term. So those 9 to 12 years old in America getting 2 to 3 doses of HPV vaccine over the next 10 years and longer. These are the long-term side effects of Gardasil, include, but are not limited to, as outlined here, to autoimmune disorders such as fibromyalgia, dysautonomia, and Guillain-Barré syndrome. Picture polio, that's Guillain-Barré syndrome. Look at the second one. I have to highlight this for you. Long-term side effects of Gardasil. All 9 to 12-year-old boys and girls in America have to get these shots. Can cause reproductive disorders, including premature ovarian failure and primary ovarian insufficiency. Health risk linked to Gardasil vaccine continuing on this law firm's website. Gardasil health risks include increased risk of cancer. Young people are getting cancer. Look at me, listen to me. Young people are experiencing more diagnoses of current cancers than ever in history. And all of them since 2006 are being forced to take 2 to 3 of these vaccines at age 9 to 12. Stop poisoning our kids. Oh, look at the next thing on here. Premature ovarian failure, which leads to infertility. Just as those 2 people in Wisconsin were claiming, the 2 sisters. However, let's go back to the ABC News article from 2013. Madeline and Olivia Mailer claim that the vaccine against cancer-causing HPV caused primary ovarian failure in both of them. The sisters are 20 and 19 years old, respectively. Remember the 20 to 19-year-old range. Remember, 20 years, 20 and 19. This is important because I'm about to show you a research study about this condition called premature ovarian failure, primary ovarian failure, which you are reading the next sentence in this highlighted box in red. Quote from Dr. Kim Gessie, MD, there is nothing about this particular vaccine that would make this at all plausible. Oh, yeah? Ignorant MD, really? All right, maybe you should go read this study from 2022 now. That was in 2013. Maybe she's read this and has updated ABC News. I went looking for an updated article, an updated testimonial of hers to ABC News. She hasn't given it yet. So, Dr. Gessie, I want you to read this article, and everyone at home, watch. This is a research study published, peer-reviewed by medical professionals around the world. It is titled Human Papillomavirus Vaccination and Premature Ovarian Failure. 2022. What do they say in this article? I highlighted in section 3.2 of this research study characteristics of premature ovarian failure suspected of being associated with the HPV vaccine. That's the title of this section. Let's read together, shall we? The characteristics of the 281 premature ovarian failure events following the HPV vaccination are described in Table 1. The average age of patients was 15 years at the time of reporting. Time to onset from getting the HPV vaccine to developing and being diagnosed with premature ovarian failure events after the date of the HPV vaccine exposure was documented to be 128 days. Mm-hmm. That's awful, knowing that 11 to 12-year-olds are being primarily told to do this. The average age was 20 years old. Remember what I just said? Remember the 20 and 19-year-old range of the two sisters in Wisconsin? The average age was 20 years old. Oh, sorry, it was 20. Oh, I'm actually too fast. I didn't see the 0.5 there. It's a little bit far, this monitor here. The average was 20.5 days after the HPV vaccine and ranged from 0 to 2.017 days. All right, you ready? Here we go. The great majority of cases, 84%, had received the quadrivalent vaccine, HPV-4, which was first introduced in the United States in 2006. Here is Gardasil from the FDA. Gardasil, I just want you to see, they said it was related to the quadrivalent HPV vaccine. Gardasil, read it together. The proper name is human papillomavirus quadrivalent types 6, 11, 16, and 18 vaccine. This is the quadrivalent vaccine. I want you to look at the right of the box. I'm going to highlight this a little bit later. This is updated information as of September of 2025. May 2025. We're not in September of 2025 yet. That's in a couple of months. But this is as of May of 2025. We are recording this in August of 2025. And I want to highlight this for you. I'm just bringing back from that research study from 2022. The great majority of cases, 84% of those who developed premature ovarian failure, had received the quadrivalent vaccine, which was first introduced into the United States in 2006. Quadrivalent means 4. If you go back to the CDC's documents, they say there are several types of HPV vaccines, of which you see Gardasil 9 here is the vaccine distributed in the United States. This is not the quadrivalent. That's only 4 different versions of HPV. Now, since 2006, it's a 9 virus. 9 different HPV viruses are all in one. The same 4 that were in the quadrivalent plus 5 more. I'm sure this is much better than the 4. They say here, in the past, the quadrivalent HPV vaccine called Gardasil and bivalent HPV vaccine called Cervarix were licensed by the U.S. Food and Drug Administration. However, look, it says in the past. I have to remind you guys, look at this. It says in the past, the quadrivalent one was available. But this Gardasil FDA website article is dated May of 2025. And this is about the quadrivalent Gardasil shot. May of 2025. All right, let's dive into this research study a little bit further. Remember, 20 to 19 years old were the 2 girls in Wisconsin. At the top left, you'll read the HPV vaccine and premature ovarian failure. This is that research study. Let's highlight just a couple things on here. So this is the HPV vaccine, and they're only looking at premature ovarian failure. Premature menopause occurred in 15% of those that received the HPV vaccine in this study. 15% of all of them. Ovarian failure occurred in 6.45% of all of them that got the HPV vaccine per this study. So that means out of every 100 possible females in America getting the Gardasil 9 vaccine, the HPV vaccine, Up to 6.5 for every 100 of these girls are going to develop ovarian failure, which ABC News medical correspondent said, that's not plausible. 6 out of 100 is already confirmed in medical research studies as of 2022. Pay attention here. Wisconsin women in the ABC News article, the majority of women with HPV vaccine associated premature ovarian failure were less than 20 years of age. 58%. I repeat, the majority of women with HPV vaccine associated premature ovarian failure were less than 20 years of age. This totally fits the ABC News article where the two sisters reported they were 20 and 19 years old, that the HPV vaccine made them infertile. And they blamed premature ovarian failure, which is published in medical science journals. Now, I'm showing you is true for up to 6.5% of those women. Remember, here's the article from ABC News. I just want to keep hammering this home. Madeline and Olivia Mailer claimed that the vaccine against cancer-causing HPV caused primary ovarian failure in both of them. The sisters are 20 and 19 years old, respectively. Remember the medical profession when interviewed by ABC News? There is nothing about this particular vaccine that would make this at all plausible, said Dr. Kim Gessie. It's been proved otherwise since your interview, young lady. What does Dr. Ardis recommend against HPV instead of HPV shots? This is very exciting. This is extremely thrilling for me to uncover how nature provides antidotes far superior and less detrimental than all drugs and vaccines for conditions, including HPV. All right, this is from Cambridge University Press. The favorable effects of long-term selenium supplementation on regression of cervical tissues and metabolic profiles of patients with cervical intraepithelial neoplasia, which is the same cancer HPV virus supposedly causes, and the same type of cervical cancer HPV vaccines are supposedly given to every child in America to prevent. This is a randomized, double-blind, placebo-controlled trial for all those medical professionals out there going, this chiropractor doesn't know what he's talking about. Your medical scientists do. And I know how to read. And I hope you follow along. This is very exciting. This is selenium supplementation. I've been talking about selenium for years. So excited about this. This study was conducted to assess the effects of long-term selenium administration, supplementation, on the regression and metabolic status of patients with cervical intraepithelial neoplasia, grade 1 cervical cancer. Oh, sorry, don't want to go back. Patients were randomly assigned to two groups to receive 200 micrograms of selenium supplements as selenium yeast or placebo daily for just 6 months. This is a 200 microgram dose of selenium that's less than 1 milligram in a capsule. They're taking every day for 6 months. The other group got nothing. Selenium intake may reduce the risk of cancer through an increased expression of selenium proteins and their protection against oxidative DNA damage and or enhanced DNA repair processes, says these research study authors. The present study was therefore carried out to evaluate the effects of selenium supplementation on the regression and metabolic status in women diagnosed with cervical cancer stage 1. We also found that taking selenium supplements daily for 6 months among those with cervical cancer women resulted in its regression. Cervical cancer regressed in those that they gave selenium to, 200 micrograms, which is what's in our selenium. In the Dr. Ardis Show, 1 capsule has 200 micrograms. Take that every day. They found in 6 months, cervical cancer regressed. In a study by some other authors and researchers, Kim et al., it was observed that selenium levels were significantly lower in patients with cervical cancer than those compared with those who didn't have cancer. So there was lower levels of selenium in the blood of those with cervical cancer. Administration of a mixture of antioxidant supplements, which included 50 milligrams of selenium, 60 milligrams of vitamin C, 10 milligrams of vitamin E, and 303 milligrams of vitamin A significantly lowered levels of cell death and lipid peroxidases among cervical cancer patients undergoing postoperative radiation therapy compared with patients who did not receive the supplements. Everything was better if they took those supplements. Several epidemiological studies studying disease progression is epidemiology. Several disease progression studies have also shown the significant associations between selenium intake and decreased risk of breast cancer and prostate cancers. Did you hear me? All of you out there who think your genes are the only things that cause breast cancer and prostate cancer, several, not one, several studies have already been done and shown the significant association between selenium intake and the decreased risk of cancer and prostate cancers, regardless of your genetics. Previous studies have reported that the cancer prevention action of selenium may be due to the antioxidant effects of selenium cysteine glutathione peroxidase. If you're new to the Dr. Ardis Show, I have done many presentations, including selenium and why it is I've recommended selenium for years to all my patients. Selenium, when you ingest it, supplement form or in vegetables or nuts, Brazil nuts included. The liver itself, when selenium is found in the bloodstream, it goes inside the liver. The liver uses the selenium to make the most powerful antioxidant your body can make. It's called glutathione. That is the correlation they're referencing here. Previous studies have reported, the last sentence highlighted, that the cancer preventive action of selenium may be due to the antioxidant effects of selenium cysteine glutathione peroxidase, the making of glutathione in the liver. In conclusion, these research scientists discovered in this double-blind, placebo-controlled trial, taking selenium supplements for 6 months by women with stage 1 cervical cancer led to its regression, cervical cancer, reversal, and had beneficial effects on the markers of insulin metabolism and these other things, VLDL, HDL, cholesterol concentrations, as well as biomarkers and triglycerides. Bring it on. This is the next research study out of 2020, the preventative effect of dietary antioxidants on cervical cancer. Everybody listen to me. They blame HPV virus on 100% of all cervical cancers. So in order to prevent 100% of cervical cancers, they say everybody needs HPV vaccines against that virus. This study is about how to prevent cervical cancer from ever developing just with antioxidant supplements. Would you like to know what they are? Let's dive into some of them. Vitamin C, also known as ascorbic acid, has several important functions that help protect and maintain the health of cells, maintaining healthy skin, blood vessels, bones, and cartilage, while also helping with wound healing. Vitamin C deficiency can lead to scurvy. Case control studies of 433 women. The risk of persistent HPV virus infection was associated with a lower intake of vitamin C supplementation. So those who did not supplement vitamin C had a higher persistent rate of HPV infection. The vitamin C intake was also associated with a reduced risk of cervical neoplasia, cervical cancer. So let's reread that. The vitamin C intake, if you supplemented vitamin C, was also significantly associated with a reduced risk of developing cervical cancer. An increase in vitamin C intake by 50 milligrams alone only daily was related to a reduced risk of cervical cancer. In fact, let's go back to that. I didn't highlight the last part of that sentence. Let's read the last highlighted sentence and continue to the end. An increase in the vitamin C supplementation by 50 milligrams a day was related to a reduced risk of cervical cancer, indicating dose dependence. This means as the dose of vitamin C goes up every day, the risk of cancer goes down. The more vitamin C, the less risk for cervical cancer. This is published in medical science journals. I'm not making this up. These other researchers are also quoted in this research study about vitamin C and cervical cancer. Manju, a researcher, and his team demonstrated that vitamin C levels in cervical cancer patients were significantly lower in comparison to controls. Furthermore, vitamin C may therefore reduce HPV virus infection and inhibit the development of cervical cancer period. Isn't that exciting? You don't have to worry about vaccines or getting cervical cancer. Just take vitamin C and selenium so far. Each vitamin may have different suppressive effects in different stages of cervical cancer development, from HPV infection to the development of cervical cancer. Healthcare workers should therefore advise women with HPV pre-infection or infection to increase their dietary intake of antioxidants to avoid smoking, with the aim of preventing the development of cervical cancer. Healthcare workers, that's medical doctors, OBGYNs, pediatricians, you should be telling your patients about vitamin C and selenium to prevent and treat an active HPV infection, to reduce the development and risk of cancer, cervical cancer. Here is another amazing research study conducted and published. Let's look at the year 2024, just last year. This is a review of the potential role of vitamin C, otherwise known as ascorbate, in the prevention and treatment of gynecological cancers. Increasing evidence has clearly confirmed that HPV infection leads to the development of cervical intraepithelial neoplasia, known as cervical cancer. And high-risk HPV infection is the main risk factor for the subsequent evolution of cervical squamous cell carcinoma, cervical cancer, and adenocarcinoma. All they're saying is the virus is confirmed to be the number one cause of cervical cancer and adenocarcinoma. A recent cross-sectional study of 2,174 females aged 18 to 59 years old in the United States found that higher blood levels of vitamin C were associated with lower rates of HPV infection, the virus, in females aged 25 to 59. Another study involving 433 females from low-income families in Brazil demonstrated that those families with higher vitamin C intake had a lower risk of persistent HPV infection over a 12-month period of follow-up. A similar study found that high-risk HPV-positive females had a lower vitamin C intake than uninfected females. These results indicate that dietary swallowing vitamin C, high concentrations of vitamin C, may reduce the risk of HPV infection and alter the status of persistent HPV infections. Ask your doctor if vitamin C is right for you. Vitamin C has been found to enhance the mucosal immune response to HPV infection. It also serves as an effective scavenger of free radicals and oxidants. It inhibits, vitamin C does, the adduction formation and decreases the frequency of gene translocations, genetic changes leading to cancer. Thus, it is biologically plausible that vitamin C may protect against cervical cancer formation. If your oncologist telling you that, your OBGYN telling you that, your pediatrician telling you that, make sure your kids get high amounts of vitamin C. A case-controlled meta-analysis comprising publications between 1986 to 2008, that's 22 years, found that vitamin C intake or other antioxidants, including vitamin E, vitamin B12, and vitamin A, beta-carotene, had a significant protective effect against cervical cancer and invasive cervical cancer. Similar results were found in another review of studies published in 2016, which showed that vitamin C intake was significantly associated with the reduced risk of cervical cancer, and increased vitamin C intake of 50 milligrams a day reduced the risk of cervical cancer by 15% by itself. Ask your doctor if vitamin C is right for you. It is. Or ask them if Immune C at the Dr. Ardis Show is right for them. It is vitamin C. Two recent cohort studies have yielded controversial results. They published a newly published study of 2,304 Chinese females found that lower vitamin C intake was significantly associated with a higher risk of cervical cancer after adjustment for high-risk HPV infection. A study from South Korea showed that the blood concentrations of vitamin C were significantly lower in 58 patients diagnosed with cervical cancer than in the control group. Another study of 46 untreated cervical cancer and pre-malignant patients from Brazil demonstrated that blood vitamin C levels were lower in the cervical cancer group. Analysis among 120 participants with invasive cervical cancer in Nigeria revealed a decreasing average level of vitamin C with the increase in the stage of the disease. As the disease progressed from stage 1, 2, 3, 4, the higher the stage, the lower the vitamin C levels were in their blood compared to control. What's the theme here? The more vitamin C, the less HPV virus infection, the less cancer you'll ever be diagnosed with for cervical cancer. Amazing. Several studies have found that the treatment of cervical cancer cell lines exhibited significant inhibition of cellular proliferation or growth of cancer cells. As in other types of cancer cells, vitamin C inhibits cell growth through multiple mechanisms. Vitamin C induces cellular stress, mitochondrial dysfunction, and DNA damage, and causing cell cycle arrest and exogenous and endogenous cell death in cervical cancer cells. That's what vitamin C does. The oxidative stress scavenger N-acetylcysteine at 5 millimoles selectively inhibited this ROS production induced by 1 milliliter of ascorbate in these cells, suggesting that vitamin C at the millimole level acts as a pro-oxidant to reduce cell growth of cancer cells. Oh, let's go back. Now, because they mentioned N-acetylcysteine, we're going to go to N-acetylcysteine here. N-acetylcysteine reduces cervical cancer formation by promoting cell death, called apoptosis. So death of cancer cells. Now, this is awesome. HPV oncogenes, cancer genes, known as E6 and E7, can evade your immune system surveillance through various pathways, leading to persistent viral infection and the development of cervical lesions on your cervix, which eventually lead to the development of cervical cancer. E6 cancer genes and E7 cancer genes are widely believed to be the cause cervical cancer proliferation and progression. The prevalence of the HPV virus 16 infection among cervical cancer patients is as high as 50 to 60%, they say. HPV 18, that viral type 16 and 18 infection, is 10 to 12%, and HPV 16 and 18 detection is as high as 65 to 72% of all females. Williams reported that the viral load of HPV E16, E6 DNA, and cervical lesions of patients with cervical cancer was significantly higher than that of controls and was closely related to the long-term prognosis of patients with cervical cancer. Just recognize they're looking at these two primary forms of HPV virus called HPV 16 and 18. Those two are the primary causes of cervical cancer growth. Look at what they found. They found that N-acetylcysteine treatment can effectively inhibit HPV virus 16, E7, its cancer gene formation and expression in a dose-dependent fashion. The more NAC, the more it suppresses the virus and its cancer genes from causing cancer cells to form. These results were confirmed in a tumor cell, evidenced by reduced tumor size and decreased HPV 16 E7 expression in tumor tissues by N-acetylcysteine treatment. Ask your oncologist and your medical doctor if NAC is right for you. It is. So now we've talked about selenium. We've shown vitamin C. Now let's read the conclusions of this N-acetylcysteine NAC supplement study. Our results demonstrate that NAC promotes cell death in HPV positive cells. Moreover, our results highlight that NAC, N-acetylcysteine, effectively inhibits the proliferation of HPV positive cells, human papillomavirus cells, by inhibiting those two markers. Our results provide the experimental evidence to support that NAC could serve as a potential pharmacological, a drug agent to prevent and treat cervical cancer. They are literally saying this could be considered to be a pharmaceutical drug prescribed by a pharmacist, written by a prescription by your medical doctor to treat cervical cancer. NAC. You don't need a prescription for NAC. It's available at the Dr. Ardis Show. Isn't this exciting? You've now learned that selenium, NAC, and vitamin C, 3 nutrients that are found very commonly in supplements, are already proven in research studies to help prevent HPV virus infection, reduce HPV viral load in the body, and reverse cervical cancer with the term regression I just showed you over and over and over. This is another research study from 2020. The preventative effect of dietary antioxidants on cervical cancer development. Let's look at more antioxidants. What did they find? Vitamin E is a fat-soluble antioxidant that stops the production of oxidative stress that occurs when fat undergoes oxidation. Vitamin E has also been reported to protect cells from oxidative DNA damage and mutagenesis, thereby preventing the development of some tumors. In a cohort study, tocopherol, vitamin E, was reported to be protective against non-oncogenic HPV persistence. If there's the HPV virus without cancer present in the patient, vitamin E was proven to be protective against the HPV virus by itself, which is supposedly the only cause of cervical cancer. In a study of 230 women, the average blood levels of alpha and gamma tocopherol vitamin E forms in patients with various grades of cervical cancer were significantly lower, just like the vitamin C studies. Monju also found the level of vitamin E in cervical cancer patients were significantly lower in comparison to controls. As above, vitamin E may widely inhibit HPV infection as well as the development of cervical cancer. Very exciting. Now, this is going to be the last mineral we're going to talk about before I wrap up this presentation, but you've got to see, I'm only going to offer 4 recommendations from these 4 nutrients with the research studies proving their effectiveness against the HPV virus, HPV infection, and viral load, how much of that's in the body, and reversing cervical cancer and preventing it. Only 4 nutrients in this presentation. This is the efficacy. This is 2022. These aren't old studies. These are new in the last 5 years. Efficacy of oral zinc supplementation on clearance of cervical human papillomavirus. This is the HPV virus is in the cervix already. And when you supplement with zinc, let's find out what they found in this randomized controlled clinical trial. Not a chiropractor's trial, not the Dr. Ardis show, conspiracy theories, controversial misinformation, disinformation. This is right out of the research, people. Let's see what they found. A cross-sectional study on 251 Italian women with normal cervixes concluded that participants with higher amounts of zinc and dietary antioxidant intake have lower odds of infection with HPV. In a study done by O'Conadade and his team, 50 cases of cervical cancers, blood levels of zinc and selenium was found to be substantially lower in women with invasive cervical cancer rather than those 100 people they evaluated who were cancer-free. Lower levels of zinc and selenium were found. I already showed you the selenium studies. An uncontrolled study of 28 patients with HPV has suggested that blood levels of inflammatory cytokines decrease in response to just 3 months of oral zinc supplementation. There is a case report of successful treatment approaches of cervical adenocarcinoma in a pregnant patient with vaginal infusion of zinc citrate. They took a pregnant woman who had cervical cancer and they shot up her vagina zinc supplements and it cured her. I'm not asking you to place our zinc supplement up your woohoo, but isn't that amazing? Has your oncologist recommended that to you, or do they just say, we got to cut your cervix out and your uterus out and radiate you and chemotherapy you? Let's continue in the study. Oral zinc sulfate is associated with higher rates of HPV clearance. The more zinc you supplement, your body removes the HPV virus. What? Oh, does your pediatrician tell you that? And regression of cervical pathology. It also reverses cervical cancer. What? The more zinc you take, you can reverse your cervical cancer. While our findings confirm the effectiveness of zinc in shortening of time to clearance of the HPV virus, demonstrated in the pilot study of 2011 by Kim and their team. Commercial preparation of zinc citrate solution was administered topically in the form of vaginal douche in this one pregnant woman with an application frequency of twice a week for 3 months. Watch this. 76 zinc-treated patients were compared against 118 controls in terms of persistent rate of HPV virus infection and cervical disease regression. They reported higher rates of HPV clearance in the treatment group. 65% of them had less HPV virus after zinc for 3 months versus spontaneous clearance in the control group, which was 25%. Infusion of zinc citrate reduces the risk of persistent human papillomavirus. After 12 weeks, they found a regression in cervical cancer disease progress in 51% versus 45% of treatment group and control group. All things better with zinc. HPV-infected patients who were treated by Pingaron and his team, who were treated with a certain commercial zinc-containing formula for 6 months, had higher rates of HPV clearance, removal of the virus from their body, and regression of pre-existing lesions on their cervix. Similarly, patients with initial normal cancer evaluation who were tested positive for HPV were less likely to develop a new intracervical lesion in the treatment group. Those who were taking zinc did not develop new cancer lesions on their cervix from HPV. Ask your doctor if zinc's right for you. This is our Dr. Ardis Show Selenium product. You will see the 200 micrograms is in every single capsule. That is the bare minimum from the research study I showed you. The very first study I showed you was selenium at 200 micrograms, proving its effectiveness to get rid of HPV out of the body, prevent, treat, and reverse cancer, cervical cancer. This is our Immune C. 3 capsules has 1,000 milligrams of vitamin C. And if you remember from the studies, it was 50 milligrams per day. And as you increase that dose from that minimum, 50 milligrams a day, the higher the dose, and I recommend up to 5,000 milligrams a day, but at least 1,000. If you just took 3 of these capsules a day, you'd get 1,000 milligrams. It will help to prevent developing cervical cancer, and it will help you clear HPV virus from the body. Even actively treat it. This is N-acetylcysteine, 750 milligrams. If you have cervical cancer, if you have HPV infection that you have been diagnosed with and confirmed, I would recommend 2,000 milligrams of N-acetylcysteine. To prevent HPV or cervical cancer, then I would recommend 1 capsule a day, which is 750 milligrams of N-acetylcysteine. This is our Zinc Plus. Zinc was the last one I just showed you. It's got 30 milligrams of zinc in a capsule. It would be 1 a day. Very simple. Now, that is my entire presentation on HPV vaccines and how they lead and are published known to cause infertility and cancer. In a world right now where 1 in 6 couples in America cannot get pregnant, where 1 in 2 couples in Canada is reported cannot get pregnant, as the infertility rates continue to go up, and as you see on every corner of every city around the country and around the world, IVF clinics, in vitro fertilization clinics where people need help to get pregnant. You might want to know that the HPV vaccine has been proven to have long-term effects of creating infertility through premature ovarian failure, and it is known to cause cancers, including cervical cancers. The goal with the Dr. Ardis Show is to bring you information that brings hope without the risks of the poisons, chemicals being promoted as saviors for your future illnesses or infections. HPV vaccines have never been proven to prevent cervical cancer 50 years down the road. Never have they done a 50-year-long study to see that HPV vaccines prevent cervical cancer in the future. Cancer rates have continued to skyrocket. And if you noticed on the Robert King Law Firm website I showed you, all cancers are increased with HPV vaccines after 10 years. That has been proven. Remember, you can go to the resources tab of the Dr. Ardis Show, click the resources tab, download the PDF titled HPV Vaccines Cause Infertility and Infertility, Cause Cancers and Infertility. Download that, share it with all your loved ones and friends. Ignorance is not always bliss. I'm Dr. Ardis. God bless you. I will see you next time on the Dr. Ardis Show.